name is Horatio Varela. I'm going to be instructing you guys how to do a chest x-ray. Can you please stand up? This is going to be my audience. You can go ahead and sit down. Alright, I'm going to be instructing you guys on how to do a chest x-ray. Most of you guys don't really know what a chest x-ray is. When y'all look at a chest x-ray, y'all just see the image and y'all don't see what y'all need to talk about. Let's see. When you do a chest x-ray, I'm gonna give you some paperwork, so you can, some handouts, so you can guys see what's going on. Let's see. Many people when they do X-rays, they just think that you look at bones, but in reality, you look at your chest, and there's like lungs you can look at. Sometimes you can see muscles. But when I was younger, that's what I thought. So that's why I'm trying to do this. How to do this. Mainly, what I'm doing is right now I'm in HCC. I'm doing radiology, and I'm trying to do X-rays, and I'm trying to go further into my education and do something else. In this speech, I will demonstrate several things about doing a radiographer. In order to be a radiographer, you just can't do X-rays. You have to make sure the X-rays are done. You have to make sure all the images are there, so the doctor can diagnose them. From the beginning, basically, I'm just gonna demonstrate you guys how to start doing a chest X-ray. You have to prepare the room. You have to get your cassettes ready to do an X-ray. And you have to also get the patient and get them instructions. You also, with women, it's very important to ask them if they're pregnant or not, because radiation is dangerous to the fetus. You also have to give them a gown and make sure to remove their bra, any type of jewelry. That's including like their necklace, and they have to put the gown to the back. Once that's ready, you have to go ahead and bring the patient over to I called it a tray, but it's called a bucky. You put the cassette in there. Once you put the cassette in there, you have to make sure your tube is at least 72 inches away from them, so you won't magnify the heart. That's where the doctor can get appropriate diagnostics for it. There's another routine X-ray you have to do. You have to shoot from the side, which once you have to turn the patient over on their left side and put both arms up. So the X-ray, if you put both arms down, the X-ray is going to shoot where your little, I guess I call it the humerus, but what your arm is, but you have to raise them up. Once you raise them up, you have to tell them to breathe in and hold it so the lungs can expand, so their doctor can see if any, either a pneumonia or any type of diseases are in there. Another thing is that after we're done doing the X-rays, we have to run them back into a machine. It's called the reader. That reader takes about like 5 minutes to do, maybe both the cassettes. But the reader, once it pops up in the monitor, you have to make sure that both images look appropriate for the doctor to diagnose. Once they're diagnosed, we can go ahead and get the patient back up and dressed, back into their normal clothes. If they have to put their jewelry on, we have to wait and let them put their jewelry back on. But once they're ready to go, they can go ahead and go. But the images is very important to get. Because if there's like any, we call it artifact, but the artifact is like a necklace or even the bra for women. If they're in the way, then we have to do it again. And it's very dangerous to do radiation again. That's why we try to minimal the repeats. And let's see. And when it comes to always have all your stuff ready. When it comes to cassettes, when it comes into like gowns for the patient to wear, always be ready because you never know when it might get busy. And this concludes my presentation.